A very good morning to all. I am Dr. Vishwaraj Mhalshekar. I work as a senior manager for Goa Shipyard Limited. It's a Ministry of Defence organization under the Government of India. Well, my study is morbidities among workers of an organochlorine pesticide industry. This is the scheme of contents. As we all know, pesticides are used widely world over. A large number of industry workers are directly involved in manufacturing, packing, and transport of these pesticides. Prolonged durations of exposures to pesticide is known to adversely affect the health of those exposed. We have various kinds of health disorders that we are noted. There are neurological, endocrine, respiratory, hematological, skin, liver disease, auditory dysfunction, and there is literature for all of these. Well, pesticides are classified as follows, but what I am focusing on is organochlorine pesticides that we have used in my study. Considering the importance of the subject and the lack of adequate published evidence, when I say lack of adequate published evidence, I mean that pesticide studies are done, but they are done on agricultural workers who are using the pesticides in the farms. There are no studies which are done on workers who are manufacturing the pesticides. So the present study was conducted with the following objectives: to assess the morbidity among pesticide industry workers and to suggest suitable recommendations to reduce these morbidities and enhance productivity of this work population. The study was commenced after obtaining all the necessary permissions, and also the Institutional Ethics Committee of Goa Medical College and Hospital had given us the ethics approval. It was a retrospective record-based cross-sectional study which involved 526 industry workers which were screened throughout the year. We had taken socio-demographic details of the exposed employees, and also selected health parameters were evaluated. Routine blood investigations were done, such as hemoglobin levels, HbA1c levels, the lipid profile, liver function test, renal function test, and ECG and audiometry findings also were taken. The data was analyzed using SPSS version 23. Coming to our results and discussions of the study, we had a total number of 526 workers. Out of that, 499 workers were male and 27 were females. I have mentioned males and females separately, I will tell in the later slide. And the mean age of the study population was found to be 33 years again. Again, this factor is also very important. Coming to the significant findings of our study, 14.2% had raised HbA1c levels. We can put them towards lifestyle diseases, but mark you that study which is there, association between type 2 diabetes and exposure to persistent organic pollutants also shows an increase in HbA1c level. There is an increase in diabetes in the people who are exposed to pesticides at their, this is agricultural workers, but the same applies for organochlorine pesticides which are present. Almost 48 workers, that is 9.13%, were found to have mild anemia. Anemia is very common among the female populations, but here we have male populations who are anemic. There is a similar study which shows the evaluation of hematological indices among insecticide factory workers. So we had a significant amount of males who were found to be anemic. Our next factor, again a very important factor, we had elevated SGOT levels and elevated SGPT levels with 14.4% and 6.2%. Even hyperbilirubinemia was noted in almost 4% of the workers. So these are the other studies we can relate to, that is the persistent organic pollutants and liver dysfunction biomarkers in a population-based human sample of men and women, and also organopesticides and the toxic effect on living organisms, which had similar results. Well, all these studies are again showing in trend with what have been seen globally. Also, there is one more significant finding what we had is that 36% of the people had hypercholesterolemia and 25.8% had hypertriglyceridemia. We could put this because of a risk factor, because it was a kind of a lifestyle that we follow, but also there has been a study saying that the exposure to polychlorinated biphenyls and chlorinated pesticides on serum lipid levels on residents of Evanston and Alabama. So this was again a study which showed similar findings world over. Mind you, these are all findings of agricultural workers who are using pesticide first-hand. There are two types of exposures of pesticide. We have occupational exposures and non-occupational exposures. When we talk about occupational exposures, it is the people who are dealing with the pesticides first-hand, and non-occupational exposures is what we hear mostly on TVs, is that our vegetables or our fruits are being exposed to pesticides which are applied on them, and they come to us again through the environmental water runoff which comes back to us. So these are all non-occupational exposures, but we are talking about occupational exposures. What the studies are there, again I make mention that these are all of agricultural workers. The most significant finding, and the one which really took me apart, was this finding, which had 6.5% raised serum creatinine levels and 5.3 workers had hyperuricemia. So the renal function tests have been deranged in my study, unlike the other studies. There has been a similar study on agricultural pesticide exposure and chronic kidney disease, whether it's new findings and more questions to be answered. So I get one of my answers over here to their question. And as far as abnormal ECG and mild hearing deficit was concerned, we did not have much significant, only 0.6% and 2.5% had these particular problems. So these are the basic morbidities which were present in selected morbidities which I thought were significant in my study. So to conclude the study, we found that a significant numbers of workers had a raised HbA1c with exposure to organochlorine pesticides. People did have derangements in renal and liver hepatic tests with anemia present, and there is also a prevalence of lifestyle disorders which we cannot ignore. So after this study, it signifies that we need to do a proper risk assessment and further necessary actions at the workplace, because there are very less studies which show exposure to pesticide industry workers. So a thorough risk assessment needs to be done. Since we are following up this study, I will try to convert it into a longitudinal study and get more data about this, so that because the working population is a young working population, we have seen that the people who are there are almost on an average of 33 years. Periodic medical surveillance is very important of industry workers for early detection and management of their health problems. So this particular study I could trace to was because of the periodic medical surveillance that we are doing throughout the year. Then there was also importance of regular information, instruction and training to all the workers who are working. Use of appropriate PPE, because all these exposures to pesticides, we think it is inhalational, but it is more through dermal contact that occurs. Most of the studies are showing that higher dermal contact is the cause for absorption of this particular pesticide, especially in packing, in loading, in manufacturing, all these units where these workers are working. It is at these places that they need to be trained, they need to be instructed, and they need to be thoroughly supervised of what they are doing with proper use of PPE. Finally, IEC to promote healthy lifestyle modifications, which is very important today. We have had several talks on this yesterday. Our chief guest also had mentioned the same to us. So healthy lifestyle promotion is very important through IEC. These were my references, which several studies and textbooks that I went through. And a big thank you to all for listening to me.
Thank you, Dr. Vishwaraj, for sticking to the time. Interesting presentation. There are questions.
Thank you, sir. Yes, sir, serum anticholinesterase we would see in an acute poisoning, sir. But here we are looking at more of a yes, sir. Yes, sir. Yes.
Yes.
How do we control confounding factors? Did you identify and control those confounding factors?
Yes, sir.
Conclusion could have been you know the cause. How many were my friends?
No, so most of them were direct employees of the company, sir. And a few were contractual workers who would be changing, but most of them were, that's why we carried out over a period of 1 year, and we're going to follow up the same way.
Exclude the contract workers, especially the workers who are not hailing from that area.
Right, sir. Right, sir.
Yes, Doctor.
I really don't know.
Yes. Sir, in my study, I have not used any of the data, sir, from the Bozon monitoring. Yes, sir. It's simultaneously being done by.
Is it crossing the PLV?
Sir?
Is it exceeding the PLV?
No, sir. No, sir.
I really compliment you on the study highlights of dermal exposure and importance.
Thank you, ma'am.
Besides the inhalational and the injectional regions for the pesticide consumption.
Thank you.
Also, confounders for these occupational hazard in the particular group of people to the general population, where it might contribute to the metabolic syndrome on the larger scale in the country premises and contributing to various lifestyle diseases.
Right.
However, as far as mentioned, there are not many confounders.
Yes.
Which was lacking. It should be highlighted.
Definitely.
There are many confounders
Yeah.
which need to be taken care of.
Yes.
So that's all the time.